Hello, guys. So, earlier, someone asked me to differentiate diagnosis versus differential diagnosis. So, I decided to just create this short video to demonstrate with you how that works. So, short lang na demo. So I also decided to do the schizophrenia spectrum because this is the family of disorders that we'll be covering for prelims, and I thought you could go and check out your handout on skits para parang 2 chapters na lang yung covered agad-agad. Actually 3 kasi kasama na clinical assessment. So yeah. Anyway, so when we talk about diagnosis, diba, we're talking about putting the correct label on a syndrome or a set of signs and symptoms experienced by your client. Okay, that that diagnosis will guide the clinician on the appropriate and best na treatment for the person. So the person can recover. Okay? However, if you look at the different signs and symptoms of various disorders, you will notice that they're not exclusive for a particular disorder. More often than not, they show up in different disorders. So for example, in schizophrenia spectrum, okay, we have the symptom of hallucinations. Okay, so in hallucinations, it's either visual, you see things that do not exist, or it can be auditory, you hear voices that do not exist, other people cannot hear. So that symptom is something that is not unique to schizophrenia. It can show up in other disorders in the schizophrenia spectrum family. So, how do we know which disorder to correctly label on the condition of your client? We won't know unless we do differential diagnosis. So here is an example. This is by no means the best chart, the most correct chart ever on the schizophrenia spectrum. This is actually kind of a shortened version, but hopefully this will clarify things for you. So we're going to perform differential diagnosis. Okay? So let's say your client goes to you and it appears like the client believes he is being tracked down by the secret service agents. Okay, so parang na-track down siya because sabi niya meron siyang very important na information that only he knows. Okay, so minomonitor siya everywhere. May surveillance on him. Okay, so ano yon? So that's persecutory delusion, right? So it's a psychotic symptom. So first, we have to look at whether it is substance induced. So meaning, has the person been taking substances or medication that may have caused him to experience those psychotic symptoms? Or does the person have a medical condition that may be influencing the occurrence of the psychotic symptom? So if yes, diba? Yes. If so, then we call it a substance-induced psychotic disorder or a psychotic disorder due to a medical condition. Okay? But what if no? Wala naman siyang na-take na substance and wala rin siyang medical condition. Okay? Then we check, is it only delusions yung meron? Or is the person experiencing other symptoms like hallucinations, other like disorganized thinking and speech or negative symptoms, diba? So if delusions only, then we call it a delusional disorder. But if there are other symptoms, then we proceed with our differential diagnosis. So next we check, do the symptoms have a mood component? So for example, aside from the psychotic symptoms, does the person also exhibit mood symptoms such as depressive episode. So, or manic episode. So, parang very hyper, very active, very ang daming racing thoughts. Okay? So, if yes, then we check yung delusions niya ba, yung psychotic symptoms niya ba, do they occur only pag meron din siyang mood episode? Okay, so meaning kung wala siyang depressive episode or manic episode, wala rin naman yung psychotic episodes. So, pag sabay lang talaga sila, yes, then we ask, does it occur only during a manic episode? So, pag manic episode lang, then it's a bipolar episode. Now, let's say, for example, wala naman siyang manic episode, depressive episode lang, along with the psychotic symptoms. It may be a major depression with psychotic features. So, now we're in the territory of mood disorders, not the schizophrenia spectrum. So, this belongs to the other family na. Okay? But let's say, yung psychotic symptoms niya do not occur only during a mood episode. Meaning, kahit walang depressive episode or walang manic episode, meron siyang hallucinations, delusions, and other psychotic symptoms. Then, we look at, do the psychotic symptoms occur for more than 2 weeks without a mood episode? Okay, so if yes, then we label it as schizoaffective disorder. Okay, if no, we check, does a psychotic episode or the psychotic symptoms occur for less than a month? Okay, so if yes, so less than a month lang siya or at least 1 month equal to, then it's only a brief psychotic disorder. Or if no, so meaning mas mahaba siya sa 1 month, pero mas maiksi siya sa 6 months. Ayan ha, take note. Mas mahaba sa 1 month, but less than 6 months, then it's a schizophreniform disorder. And then if it's longer than 6 months, then it's more likely schizophrenia. Okay? So usually, yun. So that's how you do it. So of course, there are still teeny tiny details here, like the number of symptoms, because we also have other classifications pa. Like, what if hindi siya mag-fit sa number of symptoms na kailangan for a specific disorder? But this is a general, parang just gives you a general idea of how we tend to do differential diagnosis. Okay? So, I hope that helps. Okay? Bye!